going to discuss the liver and its physiology, particularly its metabolic and transport function. So I'm Dr. Ana Angelica Macalalad Josue, and I'll be your teacher for today. So the objectives of this class include the following, no? So at the end of the class, you guys should be able to, number one, summarize the different functions of the liver, review the hepatic, vascular, and lymphatic systems, understand the metabolic functions of the liver, and lastly, we're also going to talk about the formation of bile in the enterohepatic circulation. So to summarize the various functions of the liver, no, your liver is mainly involved in the filtration and storage of blood, metabolism of carbohydrates, proteins, fats, hormones, and foreign chemicals. It's also crucial in the formation of bile. Bile, it's the major storage organ of vitamins and iron, and it's also an important organ in the formation of coagulation factors. The liver is the largest solid organ in the body, and it comprises about 2% of the total body weight, or about 1.5 kilograms, no, in the average adult human. Of course, if you're bigger, you can have a bigger liver, and if you have a chronic liver disease, you can have a very small liver. Okay, so if you cut open the liver into sections and look at it under the microscope, you will see different sections called the liver lobule. No? The liver lobule is the basic functional unit of the liver, and one liver can have as many as 50,000 to 100,000 individual lobules. And if you look underneath the microscope, no, you will see that the liver lobule will look like spokes of a wheel, no? The center will correspond to your central vein, and the sinusoids will correspond to the to the spokes of the wheel, no? And as you can see from your illustration, when you eat, no, your nutrients is absorbed into your GI tract and goes into your portal venous system and enters your liver through your portal vein. So from your portal vein, your nutrient-rich bloods will go to your sinusoids, where it will be processed by your hepatocytes and eventually drained in your central vein into your hepatic vein. Your liver is also supplied by your hepatic artery, and your hepatic artery carries nutrient-rich blood, oxygen-rich blood, in order to nourish, no, your hepatocyte. So it's the blood supply of the liver. And you also have your bile ducts. Your bile ducts, no, is directly connected to your hepatocytes because your hepatocytes is the one producing your bile, and the bile produced from your hepatocyte drains into your bile ducts and eventually is stored into your gallbladder. And then you also have your lymphatics, no? So your lymphatics is connected to your spaces of Disse, or your perisinusoidal spaces. If you look more closely, no, in between your sinusoidal space and your hepatocytes is a small space called the space of Disse, no, and it is demarcated from the sinusoidal space by your fenestrated endothelium. So your endothelium that has many fenestrated, meaning it has many large pores that allows entry of many molecules from your portal vein circulation to your hepatocytes, and your space of Disse is connected to your lymphatics, and it removes excess fluids in these spaces and drain into your lymphatic duct. So your blood flows through the liver from the portal vein and your hepatic artery. So about 1050 ml of blood, no, flows from the portal vein into your liver per minute, no? And likewise, your hepatic artery provides about additional 300 ml of blood that flows into your liver per minute. So that brings about 1,350 ml of blood flowing through your liver from your portal vein and your hepatic artery per minute. And this corresponds to about a big chunk of your resting cardiac output, 27%. No? So again, no, when you eat, no, your food gets absorbed into your gastrointestinal tract and enters your hepatic portal vein, and your hepatic portal vein contains nutrient-rich blood coming from your GI tract, no? And then it gets processed in the liver, and then your liver is also drained by your hepatic vein. Your hepatic vein drains oxygen poor blood, no, that have come from the liver, brings it to your vena cava and your back to the heart, and your heart pumps it back into the pulmonary circulation to be oxygenated again and circulated to the rest of the body. So what happens if you have damage to your liver, such as in patients with liver cirrhosis? No? In liver cirrhosis, you can have a lot of architectural changes and fibrosis. No? So this means a lot of scarring, no? A lot of scar formation in the liver, and the liver would look lobulated like that. And sometimes in chronic cases, you will have a shrunken liver from the chronic scarring, no? And the scarring and the scar tissue would cause occlusion of your blood vessels, and because of the vascular occlusion and all the other things here, like your endothelial dysfunction, increase in vascular tone, this causes a backflow of blood back into your portal circulation, no? So since the blood from the portal circulation cannot readily enter your liver, it creates a backflow. And because of the backflow, there's increase in portal pressure, no, resulting in portal hypertension. And this usually manifests in patients with, formation of varices, no, because of the backflow, no, and you will have esophageal varices, you will have spider angiomata in your abdominal wall, and you will have hemorrhoids, and these are all clinical manifestations of portal hypertension or increased portal pressure from a damaged liver. So normally, a healthy liver would look smooth and shiny, but in patients, who have accumulation and inflammation, accumulation of fat in the liver would look like this, no? And the most common cause of this is your non-alcoholic fatty liver disease, or your NAFLD. And it's the most common cause of liver disease in many industrialized country, and it's usually the patient's gateway into liver disease. No, it's the less severe form of fat accumulation and inflammation of the liver, and it's usually associated with obesity and type 2 diabetes. No, when the fat accumulation inflammation progresses, it becomes your non-alcoholic steatohepatitis, and if there's no intervention that's done in the inciting the cause of the fat accumulation and the inflammation goes on and on, the non-alcoholic steatohepatitis can progress into liver cirrhosis. And when the liver cirrhosis goes on and on and on, there will come a point when the patient will develop decompensated chronic liver disease. And these are very, very toxic patients with a lot of clinical manifestations that relate to the dysfunction of the liver. No? So sometimes, no, or most of the time, in patients with obesity and type 2 diabetes, if you're able to reverse your obesity, reverse or control your diabetes, you can actually reverse your non-alcoholic fatty liver disease and prevent yourself from getting any chronic liver disease in the future. Another function of the liver is as a blood reservoir. So normally, no, our blood storage, no, organ, no. So normally, the blood volume of the liver is about 450 ml, or about 10% of the body's total blood volume. So the liver functions as a valuable blood reservoir in times of either excess blood volume or in times of diminished blood volume. No? So, for example, in states where you have excess blood volume, such as in heart failure, particularly your right-sided heart failure, no, when you have a right-sided heart failure, the right side of the heart cannot pump blood into your pulmonary circulation. So, some of the venous return from the body, instead of being pumped into the pulmonary circulation to be um, reoxygenated, it backflows. No, it cannot be returned. So the venous return stays back, no, because of the back high pressure in the right atrium, and this causes back pressure in the liver. No, the venous return from the liver cannot go back into the system. So when this happens, an additional 500 ml to about a liter of extra blood is stored in the liver. On the other hand, in times of diminished blood volume, let's say you have an acute bleeding, let's say you encounter trauma and and you're bleeding internally, no, and of course your the other organs of your body would need blood, no, the blood from the liver that has been stored can be utilized by the other organs of the body, the other important organs of the body, such as your heart, no, and your kidneys, no, in order to maintain circulation until an intervention comes in. Okay. A very important function also of the liver is the metabolic part. No, the metabolic function of the liver, no, plays a major role in our body's metabolism. No, so first, no, we're going to discuss the role of the liver in carbohydrate metabolism. So the liver is as one of the storage organ for large amounts of glycogen. No, so your liver, when you eat, you're able to remove the excess glucose from the blood. It's stored as glycogen, and when your body needs it, when your blood sugar becomes too low, the liver can be mobilized to release glucose from your stored glycogen. And this is called the glucose buffer function of the liver. So to illustrate, no, when you eat, let's say you eat a burger, fries, no, your blood sugar or your blood glucose will go up. And this signals your pancreas to secrete a hormone called insulin. And your insulin now in turn will tell your liver to increase the process of glycogenesis or the formation of glycogen from the glucose, no? And your glucose will now be stored as glycogen. And when the glucose is stored as glycogen, your blood glucose levels will go back to normal levels. We don't want your blood sugar to be always high. Of course, that could cause problems for the body. So we want your blood glucose levels to go back to normal. So when you're not eating, let's say when you go to sleep at night, you're not eating, no, your blood glucose levels start to go down. But your body still needs glucose. Your brain needs glucose. Your heart needs glucose. So you need to keep your blood sugar levels to normal in order to supply the crucial organs of the body, no? So when your blood glucose starts going down when you're not eating, no, when you're fasting or when you're sleeping, this signals the pancreas to release a hormone called glucagon. And your glucagon now will signal your liver to start breaking down glycogen in the process of glycogenolysis. No? When you break down glycogen, your glucose is released, no? And this helps increase your blood glucose levels back to normal. On the other hand, your glucagon also stimulates your liver to start gluconeogenesis, or the formation of new glucose from either amino acids or glycerol from your triglycerides. No? And your gluconeogenesis also results in an increase in blood glucose back to normal levels. And this is what we call the glucose buffer function of your liver. Next, your liver is also involved in fat, is also the site of your fat metabolism, no? So, when in order to be able to utilize fats to get energy from it, no, we need to be your fatty acids need to undergo beta oxidation in order to supply energy for other body functions. Your liver is also the site of synthesis of large quantities of cholesterol, phospholipids, no, and most lipoproteins, no. So your cholesterol is important in your cellular metabolism, your hormone synthesis, no? Your phospholipids as well, and your lipoproteins are important in shuttling or transporting triglycerides from your liver to the peripheral circulation, and from the peripheral circulation back to your liver as well. So your liver is also the site of synthesis of fat from proteins and carbohydrates, or your fatty acid synthesis. Next is protein metabolism. No? So your liver is also the major site of protein metabolism in terms of deamination of amino acids. So your amino acids, before they can be utilized as gluconeogenic precursors, or before they are transformed into other um, substances, no, they have to undergo deamination, or the removal of the amino group, no, before they can be utilized, no. And when you have ammonia, no, it's also a toxic substance. So in order to remove ammonia, your liver also forms urea. No, the formation of urea is important for the removal of ammonia from the body fluids. No? So I forgot to mention that deamination does not only occur in the liver. It can also happen in other organs such as your kidneys. But the liver is the major site of deamination. So if the liver is unable to form urea, let's say your patient has decompensated liver disease, or your patient has acute liver failure, the liver is unable to form urea, the plasma ammonia concentration rises rapidly and results in hepatic coma and death, because you are unable to remove ammonia from the body. Okay? Your liver is also very important in the synthesis of your plasma protein. So what are your plasma proteins? You have your albumin, your prealbumin, you have your binding globulins, no? Particularly your hormone binding globulins, and these are usually binds to water soluble substances in order to transport them from one part of the body to the next. So, for example, your um, thyroid hormones have to be carried in plasma proteins. Your this is your albumin or your thyroxine binding globulin, in order to be carried into the other parts of the body in order to prevent it from being prematurely degraded in the circulation. So your plasma proteins are very important. Your plasma proteins are also important in maintaining intravascular volume, no? So your plasma proteins pulls in fluids inside the blood vessels to maintain intravascular volume. If you have you have liver problems, you will have low synthesis of plasma proteins, particularly your albumin. You're unable to pull in fluids intravascularly. So sometimes the fluid will seep out into the interstitial space and manifest as edema. Your liver is also the site of interconversions of the various amino acids and synthesis of other compounds from amino acid, or the formation of your non-essential amino acids. The other metabolic functions of the liver is also a storage site for many vitamins, particularly your vitamin A, your D, and your B12. So your body is able to store vitamin A that can supply your body for 10 months supply of vitamin A. In your body, your liver can also store vitamin D in the form of 25 hydroxy cholecalciferol, or your 25 hydroxy vitamin D, and it can supply your body for 3 to 4 months. Your liver is also capable of storing vitamin B12, no, for as long as more than a year, no. So that's why if you eat a lot of vegetables and fruits and you eat nutritious food, no, and you're able to absorb this very efficiently, no, you don't really need to take a lot of vitamin supplements daily, because your liver is actually able to store them and can actually supply your body readily whenever you need it. Whenever you start becoming deficient, your liver can replenish your need for these vitamins. No? So remember, the storage form of your vitamin D is 25 hydroxy cholecalciferol. Your liver is also the major storage organ of iron, and iron is usually stored in the liver as ferritin. So your liver produces a protein called apoferritin, and your apoferritin can readily combine with iron, no? And be stored as ferritin. So when your body needs iron, let's say you have gastrointestinal bleeding, or you have chronic abnormal uterine bleeding causing you to develop iron deficiency anemia, your liver can replenish your iron store, can help in the formation of new hemoglobin, no, to replenish your lost hemoglobin from the bleeding by mobilizing the stored iron in the liver. And the greatest proportion of iron in the body is stored in the liver, except of course for the hemoglobin in the blood. And likewise, if you take too much, let's say you have excessive iron in the body, let's say you're taking a lot of iron supplements, or you're not able to excrete excess iron in the body, this will be stored in this will be pathologically stored in the liver, and this can cause also chronic liver disease, called chronic liver disease as well, no. Another important function of the liver is the formation of blood substances used in coagulation, no. So your coagulation factors such as your fibrinogen, prothrombin, accelerator globulin, factor 7, and several other important factors. And your liver requires vitamin K in order to be able to synthesize these coagulation factors. And these factors are what you call vitamin K dependent factors, or factors 2, 7, 9, and 10. So your vitamin K dependent factors are your factors 2, 7, 9, and 10. So some patients, when they have decompensated liver disease, or they have acute liver failure, they're unable to synthesize these coagulation factors, and they can manifest with bleeding because they're unable to um, stop their own bleeding with the lack of the coagulation factors, particularly your vitamin K dependent factors. So your liver also has important function in detoxification of several toxic substances that enter our body. No? So your liver is able to limit the entry of toxic substances into the bloodstream, and just like a garbage disposal unit, no, it can extract potentially toxic metabolic products produced elsewhere in the body and convert them to chemical forms that can be excreted. No? So some drugs are excreted through the liver. No? So that's a one important function of the liver. So another important function of the liver is your first pass metabolism. So your first pass metabolism is a phenomenon of drug metabolism whereby the concentration of a drug is greatly reduced before it reaches the systemic circulation. So for example, when you take a tablet of 500 milligrams of paracetamol, it doesn't mean the 500 milligrams of paracetamol is actually able to reach your bloodstream, no? So some of the 500 milligrams of paracetamol undergoes first pass metabolism in the liver, and only a fraction of that paracetamol actually reaches, the site where it's supposed to go, no? It is the fraction of the drug lost during the process of absorption, which generally happens in the liver. So the liver also is important in the body's defense, no? Your liver has what we call Kupffer cells, no? So yung Kupffer cells are actually macrophages. Macrophages that are phagocytic and are particularly important in removing particulate material from the portal blood, no? Including even bacteria that may enter the blood from the colon. Remember, our colon has bacteria in it, and some of them can break the barrier and enter the bloodstream, and it can be filtered or caught, no, by your Kupffer cells in your liver. And even some of the substances that enter the body through the food, no, sometimes your food can have bacteria, and if it breaches if it if the defense of your GI tract is unable to neutralize it, your Kupffer cells can actually help in the body's defense, no? Another important level of defense of the liver are your enzymes. Your enzymes are able to metabolize and modify both endogenous and exogenous toxins so that the products are in general more water soluble and less susceptible to reuptake by the intestine. One example would be your alcohol. So when you drink alcohol, no, normally, when you drink alcohol, normally your alcohol is a toxic substance, no? So your liver um, acetylates it and converts it into a less toxic form, for the body, facilitating its excretion out of the body. As part of the detoxification function of the liver, your liver is able to also perform phase 1 and phase 2 reactions, no, on several substances, no. For example, there is a toxic substance, and it can be either undergo phase 1 reaction in the liver, either oxidation, hydroxylation, and other reactions, and this is catalyzed by your cytochrome P450 enzyme. So your cytochrome P450 enzymes is a group of enzymes that does all these phase 1 reactions, and and the inactivates, this toxic substances, and then on the phase 2 reaction, this transformed substances is conjugated or combined with another molecule, such as, let's say, glucuronic acid, sulfate, amino acids, in order to promote their excretion in the bile and later on into the feces, no? So for example, um, let's say a drug needs to be excreted into the body, so that drug undergoes phase 1 reaction in your cytochrome P450 enzyme, and then later on combined with another substance and excreted into the bile and into the feces. So this ends the part 1 of the lecture on liver physiology. So watch out for the part 2 of this lecture, which is bile formation and secretion. So the second part is actually a shorter um, portion of the lecture. Okay, so stand by.